or on YouTube, channel 𝗛𝗏𝗁 8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗵𝗏𝗶 as we discuss the latest health and medical topics with doctors from 𝗵𝗏𝗶. For a healthier and uplifting lifestyle, tune into Healthline with 𝗵𝗏𝗶 on 𝗛𝗏𝗁 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗵𝗏𝗶, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗏𝗁 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗵𝗏𝗶 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗵𝗏𝗶. I'm your host, Nicole Jacinto. Today, we're going to discuss gastroenteritis. I think a lot of people, it's fairly common. I don't know. We'll ask the doctor right now. It strikes. I think. Well, let's just ask him anyway. Today with us on the show, we have Dr. Jello or Angelo Losada. He is a gastroenterology and hepatology specialist. Am I correct? So you cover
Yes,
the
correct,
stomach
Ma'am
area
Nicole.
and liver, right?
Yes, that is correct.
Thanks, doctor, for coming on the show again and for sharing your.
I'm happy to be back.
Thank you for sharing. Thank you for sharing your time and your knowledge with us and making the effort to help us inform and educate people about medical issues. And today, so we're gonna talk about gastroenteritis, which we hear all the time. And maybe there are a few like simple things I could ask you later on, because I think sometimes we interchange terms and stuff. Okay, we interchange terms, and I just really want to get from you like very maybe some specific answers so people the body or digestive system does it affect.
Well, yeah, Nicole, gastroenteritis is actually it's a short-term illness, and it's usually caused by inflammation or infection of the gut.
The gut.
Or the digestive system. And usually this would present with a variety of symptoms that is very familiar with everyone. No, I mean, one time or the other, you've had like abdominal cramps, diarrhea, vomiting.
Okay. Sorry, can you say that again? Nausea? Did you say nausea?
Nausea, vomiting, diarrhea, loose stools, and as well as abdominal cramping. No, you have like have a cramp around your belly area.
Okay. So, doctor, when you say gastroenteritis, like strictly, is it just the stomach and the intestines that are swollen? Because every time there's an itis, it's like it's swollen, right?
Yes, that is correct. No, so the fact that we say gastroenteritis, no, it's the digestive tract. So it doesn't matter. No, sometimes you can have inflammation anywhere in the digestive tract. No?
So let's say esophagus also, or the sphincter between the stomach and the esophagus. That's also like that. There's no strict definition that it's just the stomach and the intestines. Like it could be anything along the digestive tract.
Yes. So our digestive tract starts from your esophagus, no, down to your anus. So it's a very, very long tube, no, and you can have a lot of inflammation in any of those areas. But mostly, commonly, most of the gastroenteritis that happens, in the general population would be more focused on the small intestines. Yeah, so it's usually you have a lot of inflammation in that particular region of the gastrointestinal tract.
And doctor, can you tell us again how long the small intestine is? I mean, it's we might think of it as, oh, it's just that short, but it's actually a long is it an organ, or whatever the term is, like after your stomach is the small intestine and then the big intestine. How long is it? And it's just all coiled up.
Yes, your small intestine is actually the longest part of your digestive tract. No, it's roughly around 20 feet. No, so around 7 meters in length. So there's really a lot of surface area there that can get infected. No, it's the absorptive portion of your digestive tract. So that's where when you eat, that's where all you absorb all of the nutrients. No, that's the site where you absorb all of the nutrients. So you can just imagine, like, if you ingest something, no, and that's where all of the action takes place, no? So
Yes.
the microbes, whatever you ingested, the toxins and all of those things greatly affect that particular portion of the gut.
Okay, so doctor, what causes gastroenteritis? Is it bacterial or viral or both?
There are a variety of known causes of gastroenteritis. No, the most common actually would be viral infections. No,
Okay,
so the
viral.
viral infections are usually self-limited. No, they go away by themselves. No, I'm sure everybody has had gastroenteritis, and
Yes.
usually it would resolve in like 1 to 2 days.
Mm.
And usually these are caused by the viruses. No, some viruses such as like your norovirus, uh,
Yes, actually, what
your
is the norovirus? It,
rotavirus, adenovirus. No, so those are some of the common viruses that you can just acquire, and they can cause gastroenteritis.
okay. So, doctor, all right. Well, let's stick to the viral form of that, or the viruses that can cause gastroenteritis. Since we're on that right now, you mentioned the norovirus and other viruses as well.
Mhm.
Uh, are there are when we commonly use the term stomach flu, right?
Yes.
A lot of people do. So, is that usually in reference to gastroenteritis?
Well,
Uh,
in layman's term, no, it would actually be almost synonymous to each other, no.
but
I
it's
think,
not really a flu, right? It's just something that people apply a term. I have the stomach flu.
yeah, well, stomach flu is usually is would pertain to, I mean, like flu would pertain to like a viral infection, no. So when you say stomach flu, loosely,
Mhm.
we're referring to an infection of the gut, no, or your digestive tract. And
Okay.
obviously everybody is very familiar with the stomach. So
Yes.
I mean, so it's layman's term, it's like a stomach. It's a
Mhm.
stomach issue, when in
Yes.
fact it could be more of like a small intestine or gut issue. The small
Yes.
intestine gut issue.
Yeah, because we as syempre as a doctor, and I mean, actually we have to differentiate in the anatomy of the body. The
Yes.
stomach, after the esophagus, please jump in and correct me if I'm wrong. Like, okay, your mouth, and then I guess is it your esophagus already? It goes down and then into your stomach, and then after your stomach, it goes into your intestines where it's digested, and as you said, that's where the action takes place. That's where our body absorbs all the nutrients or all the junk that we eat. And then of course the colon is where it that's where we get that's where the feces is that we excrete later on, which is the stuff that we don't need in our body. And so doctor, when we say stomach flu and viral infection, how do you get these viral infections, and how contagious are they? Do you get it from other people? And what would it entail? Or is it airborne, or do you have to share food?
Well, actually, the best way to prevent, no, I mean, if we're talking about prevention of gastroenteritis, is essentially, making sure that you have clean hands. No, I think
Mhm.
that's the greatest cause, no, of
Mhm.
having like gastroenteritis is just having bad hygiene. Uh,
Yeah.
it can be passed on. It's highly infectious, can be passed on from one person to the other. For example, somebody with like gastroenteritis uses the toilet, doesn't wash his or her hands very well, and somehow that finds its way to your mouth,
Yes.
then you can actually have an infection, no?
So it's
So
also the cleanliness of food preparation also, and we don't always eat at home, right?
yes, it's basically hygiene related, no? A big factor is the hygiene.
Because the viruses that you mentioned, they will be like, if you wash your hands and you're clean and you're hygienic and you're, I guess, careful, and you don't have to be super extra careful. That should be part of the routine, I guess. If you're, yes, it is part of a lot of people's routine. But sometimes if you're in a hurry or you don't eat at home, or somebody is not preparing the food properly, then yeah, it'll get you. So is it from surface to surface, or like, let's say if you spend time, I'm just curious so that people will understand that if you spend, because I've heard of people, I don't want to go near you because you have gastroenteritis or the flu. Can you get it just by talking to them?
No, not by talking to them, but actually having like direct contact, physical contact with anything that they touch. No, for example, of course, somebody would use the toilet. If you don't use, for example, you're not using, like, for example, disposable tissues, or
Yes.
maybe you're using a towel to dry your
Ah,
hands, no, and then you didn't wash your hands properly with like soap and water, and then that gets transferred to like a towel,
mm,
and that towel gets used by another person. That's
yeah,
how you can actually transfer it, no,
yeah.
um to another person. Or if that person will be handling food, then
Yes.
that can actually be a way to transmit the virus.
Or like, let's say let's say you and your friend got together or whatever it is, and then you're out, and then you don't know, and your friend doesn't even know that they have got gastroenteritis, or they have that one of the viruses that you talked about, I mean, that you mentioned, and then, like, oh, you share some chips. I mean, and then does it, like, the saliva, and that happen, or
Oh
is
no,
it,
not from the saliva, no, but basically from the
it's really feces?
yeah, from the feces, fomites, things that get touched.
All
So,
right.
the bacteria or the virus can actually live in like materials, for quite a while, and then they can get transferred on.
Yeah. And that's the thing too, doctor, like, with I mean, let's say, like, typhoid fever, and or typhoid, and things like amoeba, or baka that's more bacterial, I'm not sure, and we haven't discussed the bacterial.
Amoeba is a protozoa, so it's another form of an infection,
Okay.
which can actually cause gastroenteritis. No, gastroenteritis is a general term. No, it's a
Okay, like,
general term of inflammation and irritation of the gut. No, so you can
mhm.
actually have gastroenteritis from other sources as well. No, you can have like toxins, bacteria.
Yes.
Yeah,
Mhm. And
and
like, it's also like with the handling of food or drink, right? I mean, let's say you go out, and then you go out to a public place, and then you order a drink, and the people don't wash their hands, and then even just touching the ice. I mean, that can happen too. I mean, and if you get these other, I mean, if you happen to pick up, and then I remember before, they were like, don't eat the raw fish or whatever, because I know some people who got amoeba. So essentially, it's like food poisoning, right? I mean,
well, you can get like, for example, salmonella, no, which
mm-hmm.
is mostly found in animal feces.
Mm-hmm.
So that's a bacteria that you can get, no. And then sometimes uncooked meat can contain like Campylobacter, which is
Mm-hmm.
another kind of bacteria that you can actually
Mm-hmm.
acquire. So it's quite important to make sure that the cold food stays cold and the hot food stays hot.
Yes, yes. Thank you, doctor. And of course, the heat, when you when you I like what you said just now, because a lot of people will be like, I'll cook it, and then after it's cooked, I'll just leave it out there and I won't put it in the refrigerator.
Yes.
But it's so hot in this country. And
Yeah.
you know, even elsewhere, like what you said, okay, the if we're going to, let's say, keep it to eat it later, keep it in the refrigerator.
Yes,
So the cold
definitely.
food should stay cold and the hot food should stay hot. So like when you serve something or when you cook something, as you said, sometimes there's uncooked meat, especially in cases where, you know, maybe chicken. Sometimes you'll see it's red. I'm like, oh, don't eat that. Have it cooked more.
Yeah.
Or how about like stuff like steak, and some people like it rare or, you know, medium. Is that also like a risk
Well,
for
definitely, definitely, there's some risk, no, but it's really mostly on poultry, no.
yes.
Mostly poultry is the one that is implicated in infections such as, salmonella or Campylobacter.
And
Um,
also eggs, no? Like if
yes,
you
eggs,
raw.
chicken, and the like.
Okay. How about like sushi and sashimi?
With sushi and sashimi, there are other types of infections as well that are associated with raw fish.
Mm.
So yeah, so I mean, you have to be very careful. No, I mean, yeah,
And discerning
there are
where you get.
there are actually worms or what you call nematodes, no, that are present in like beef
Mm-hmm.
and fish. So you
Mm-hmm.
can actually have like parasitic infections
Mm-hmm.
in the meat of like fish and beef that you can actually ingest.
Okay. Thank you, doctor. It's just to, you know, inform people more, like, you know, you may go out or and eat, or like people who prepare it at home and you're not actually like really versed in preparing sushi or sashimi, and you know, it could get contaminated. How about, doctor, like things like do chemicals play a part? I mean, well, okay, let's say you ingested a chemical, like you drank some you ate some soap or ethyl or rubbing alcohol by accident. I saw that during COVID, and you know, we were laughing like because people were very were really paranoid. So I got these donuts, and then this actually happened, and then they washed the outside of the box, and then they alcoholed it. But then they're like, okay, I'm eating a donut that tastes like soap and alcohol. Like, could that in essence like irritate your stomach or?
Well, as if you're taking like excessive amounts
Mhm.
of a particular toxin, that you're not supposed to be ingested, then it can cause some irritation.
Mhm.
And of course, that irritation will cause a lot of inflammation, and that can lead to some form of gastroenteritis. No, so
Okay.
as I mentioned, gastroenteritis is not just exclusive to like diarrhea or diarrhea. You can have like cramping, abdominal pain,
Yes.
nausea, vomiting, and it's really from like an inflammation or irritation of the gastrointestinal tract. So in
Doctor,
that particular sense, that's an
an
irritation,
irritant. Yeah,
right?
an
Yes.
irritation. Okay.
Yeah.
Yeah, so because we're talking about keeping clean and everything, but also like don't I mean, like don't go the other way and be like washing your hands with soap and then pack, like put food. It's not gonna make it better. It could be an irritation, exactly, and the amount you ingested. So doctor, when we're talking about symptoms. Are there other symptoms too? What would you consider mild symptoms? You said earlier that usually gastroenteritis, I mean, you said it's a short-term illness, no?
Yes.
It usually lasts for 2 days. Um oh, by the way, before that, like if you get a virus or you ingest a bacteria, what is usually the incubation period before, you know, it comes out? Because we've heard of stories of, you know, people ate somewhere and they essentially got food poisoning, and of course there would be gastroenteritis present that, you know, it would present with some of these patients. But how long usually does it take? Is it quick? Like, will you feel it right away?
Yeah, usually that's a very good question, because I always ask my patients who come to me with gastroenteritis. I ask I do a food recall, of what of the things that they've eaten. So first and foremost, I would ask first the symptoms when they started to have symptoms. So like, for example, they had like episodes of vomiting or abdominal pain or cramping or diarrhea. So I asked that first, and then we backtrack what they've eaten maybe around 6 to 8 hours prior. So for example, somebody had a diarrhea episode at around maybe 3 o'clock. So it's not really what that person ate at lunchtime. It could have been something on the breakfast or maybe sometime even in the during the dinner time.
Yes.
It usually takes around, like maybe around 8 to 12 hours before, things start to percolate, So that's how long it starts to manifest.
Okay. All right.
So it's not necessarily what you ate just before,
Yes.
but it could be something that you've eaten maybe 1 or 2 meals back.
Yes. Okay. Thank you, doctor, for that information, because sometimes people will eat now and then they were already kind of, can you also be like not feel the symptoms and then suddenly feel it after a meal, or and then you might think it's the last meal you ate, but it actually, as you said, takes about um 6 to 8 hours or maybe a little more. Is that because it's in the in the small intestine at that time and it's
Well, you
already
have to understand that our normal transit time in the stomach is around 4 hours. So it's around 4 hours before you start emptying everything in your stomach, and it starts to go down in the small intestine, no? And then you give it maybe around another 2 to 6 hours, another 2 to 4 hours for the stuff to be absorbed in your small intestines, no? So that's probably the time it's going to start manifesting.
Yes. Okay. Thank you, doctor, for making that clear. I'm sure a lot of people appreciate that information because, they're like, oh, what did I eat? What did I eat? It might be this, it could have been that. At least it can help them and their doctors like you detect what it is exactly that, where they got it, what it is exactly that they ate, and maybe where they ate, that kind of thing, so that they can pinpoint where, like, not to go or what not to do, or I don't know if it also might help you as a doctor treating them to, when it's to see how bad it is. Okay, let's talk about that, the symptoms and the manifestation. You mentioned nausea, vomiting, diarrhea. Are there any, do you consider, and abdominal cramps in the belly area? And you said takes about, somebody gets affected 1 to 2 days. Are there any, do you consider that mild or medium or severe, the symptoms? Like, is it the degree of their vomiting, like how much they're vomiting, or how much, they're having to run to the bathroom for diarrhea, or how dizzy they feel, or are there other more severe symptoms also?
Well, we usually check for a patient who has gastroenteritis in terms of their hydration status. So that's actually the most important thing that we have to determine first, no? And that helps us assess the severity of the gastroenteritis and the appropriate management. So mostly those who have mild to moderate dehydration, they have good skin turgor, their lips are still